here in the abdominal cavity. I had to pull it out from behind here a little bit. Here is the spleen. Remember, the spleen is only on one side. It's not like the kidney that's bilateral. You only have one spleen on the right side. One other thing I did want to show you, if I can, is here. This right here, this pinkish, high pinkish structure here is the stomach. Okay, so we pretty much identified all of the major organs. Now we're going to work down ourselves a little bit lower in the abdominal cavity. Some very important structures here, and remember on our class we talked about some of the major arteries coming off the descending aorta. And I'm going to be able to show you just two of those here. The celiac trunk is a little bit higher. You can just barely see it down in here. And just a little bit below the celiac trunk you see the superior mesenteric artery, which you can see is going up and feeding the small intestines here, if you'll remember that we talked about that in lecture. That as we proceed down now, it's a little bit harder to see right here, but you can also see coming off the descending aorta is the inferior mesenteric artery, much smaller. If you look at this, it's compared to the superior mesenteric artery, it's much smaller, as you see right here. And of course that, remember, goes straight down feeding the colon, as we talked about in lecture. So now we're going to proceed down a little further, and as we get to the bottom of the descending aorta, now you'll see a branch right here. You'll see the two branches separating off. I'm going to grab one here so you can see that. Here is the common iliac. So we have the right and left common iliac branches branching down, and then as we go even a little deeper down in here, you can see again a second branch, which would be your internal, and your external iliac arteries. And of course your external iliac arteries, after it goes down and passes underneath the inguinal ligament, then becomes your femoral artery, which is what you see right here in the legs.